Hey, GLP-1 plus sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault. Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better and my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster. Confidence higher. Price cheaper. See if you qualify at ro.co/TV.
Welcome to the Plus Sides Podcast. How you doing, Kat?
Hey, how are you?
I've been doing this for 2 years now.
2 years.
Welcome. Yes. So we're going to do an intro of who we are. And if you're not new here, this is your cue to fast forward. I'm Kim. This is the Plus Sides Podcast. It is a podcast for people who have metabolic disease. So like whatever that would be, PCOS, insulin resistance, obesity, all the things in the land, or anything that is affected by metabolic disease. So we talk about all of that here. It's an educational health and wellness podcast that is meant to give you all the information you need so you can advocate for whatever health you need. When we started, or healthcare you need, when we started this podcast, it was very much focused on GLP-1s. But as we've lost weight on GLP-1s and learned from all of these obesity specialists and endocrinologists and all these doctors, we've learned it's actually not about weight at all. You know, it's really about health. And so we learned that we kind of wanted to have a podcast where, or a place like a community where you could always come because this is a chronic disease. There is no cure for it. So we wanted to have as many like resources and like a safe space for you without trolls and stuff where you could come and learn and be able to talk with people that understand. So that's what we do here. If you're wanting stuff on GLP-1 specifically, literally the first 18 months of our work is all about it. So you can go back and check it out from season 1. Don't forget season 13, which is Rosie O'Donnell. Don't forget, it's a good one. Okay.
It is a good
Pivotal
one.
one for us. And I've been on GLP-1s for 2.5 years, almost 3 years. I've lost 110 pounds. And then dun, 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 I hit perimenopause and gained 10. And I'm
It was a
pissed.
fun time.
So, but there's reasons for all these things. And like, I think that it's important that we understand what's going on in our body. So I think also like there's a certain level of things that you tell yourself, that you need to be able to do so that you can move through hard times. And so I think that education is key for that. Blah, blah, blah. I'm Kim. That was 2 minutes. That wasn't too bad. Kat,
Good.
who are you? What you doing? What you doing here? How are you doing?
I just have to mention here that before we were starting, we were sitting over here just bitching about our topic that we're going to be talking about. But yeah, perimenopause.
Perimenopause. Menopause and perimenopause.
Menopause and perimenopause. But I am Kat. Kat Carter 7. You can find me on the TikTok. I've been on the MJ. I've been on Terzeps for 2.5 years, almost as long as you, Kim. A little bit, I think maybe not as long. The fun part about getting on this, I think I'm at 80 pounds now. I don't know. I'm kind of staying there again. Life, hormones. But when I first got on it, I tell everybody, we talk about this all the time. I was very secretive about it. Don't tell anybody. And until I saw Kim talk about Ozempic, all about her Ozempic life on TikTok. And I was like, oh, Kim, you're on it too?
No more shame here. Let it all hang out.
I think I was still in your DMs about it for a while too. So.
Yeah. You were like, you are too. I'm like, yeah, that was before I had blown up or anything. So that was fun. And then we were like, hey, let's start a podcast.
We're like, here we are.
Yeah, here we are. So that's what we do. We talk about, we're going to combat all the misinformation we can with education. We're so glad for you to join us today. Kat and I are both going through perimenopause and it sucks really bad. And we wanted just to learn all about it the same way we've done with GLP1s, right? One of the way we've done with obesity and PCOS and insulin resistance. We want to talk about it so that you guys know and hopefully, feel better about things. That's the goal. And I am tired. I'm not going to lie. Guess why? Okay. So we have a very special guest. We're going to invite her in and ask her all the questions in the land. So let's welcome.
So excited. Dr.
Kat Brown. How you doing?
I'm great. How are you?
We're tired, but good.
We're doing great. A little caffeine.
Yeah, we'll get there. It's all right. We got this. Made dinner, had some nutrients. I'm getting there. But we're so glad to have you here. Kat and I both, when perimenopause hit, went to Winona. That's who we found. And I've had such a good experience. And I was just like, we just have to talk about HRT. We have to talk about all the things. So if you would tell us a little bit about you, we would love to know about kind of who you are and then how you help people.
Sure. So I'm a board certified OBGYN physician who basically was in the Army for 12 years. I moved around a bunch. They paid for school for me.
Thank you for your service.
College. Oh, thank you. They paid for college and for med school because I came from a family where there really was no college fund, and nobody had gone to college before I did. So I had a great experience moving all around the country, working in the Army. And then when I got out, moved back to the Philly area. But then I started personally going through some chaos and started entering my own perimenopause journey. And right about the same time, as I was practicing as an OB physician and struggling with sleep disorders and all kinds of stuff, I was approached by the chief medical officer at Winona because they were an early company growing and looking to expand into Pennsylvania, which is where I was located. And they needed a board certified physician in the state to take care of Pennsylvania patients for them. So I, at the same time, was also trying to advocate for my own health and wellness and trying to get the help that I needed and getting so many doors closed in my face and so many roadblocks, even as a physician, talking to other physicians and hoping to get, at least some professional courtesy and consideration. But I just realized that there was just not great resources out there for patients. And so the concept of Winona really appealed to me because we exist as a company to give patients an option who don't have doctors who are willing to help, to listen, to prescribe. And so it gives a lot of women a great alternative when they're getting no answers from their primary care doctor or from their own OBGYN. They can get on the computer and really easily, fill out a nice, quick medical questionnaire and get some help. And so, yeah, that's me. I also have 3 kids and, do a lot of things outside of medicine as well. But like one of my big hobbies is going to see live music. I love gardening. But I myself, like you guys, are just struggling through this time and trying to find the best way to navigate it myself as a patient too, which I think gives me a nice advantage in helping patients because I've been there, right?
Yeah.
Yeah.
Absolutely. That's such a good perspective. Like that's honestly, some of our favorite doctors that we've had on the show are people who have obesity, like endos and obesity specialists that have obesity, just because they understand the patient perspective and the struggles like better than anybody,
Yeah.
Which is nice because it's just, you get better care. And it's like they're better at communicating and understanding what you're trying to say. Mm-hmm. Yeah. Like you're trying to explain food noise, a regular doctor's kind of like, right. But someone that understands food noise, like, yeah. Right.
Yes. And I'll tell you too, I personally have struggled with being overweight since I had my children. Mm-hmm. I come from a family where my mom has been on Weight Watchers, I think, since I was in high school. And I think that the youngest I was when she took me with her to be her companion was like maybe 14 or 15. Yeah. I was dragged to those meetings in the weigh-ins and all that kind of stuff. Yeah. And since my youngest was born, I've been pre-diabetic. And so I'm actually also on a GLP-1, and it's been a godsend for me because it's.
Why didn't you tell me that sooner?
Now this is juicy.
Yeah,
juicy talk.
Yeah. So it's been, it's one of those things where I did coaching, I did every restrictive diet imaginable to try, and I could lose weight on fad diets, but it was never sustainable. Yeah, right. It was one of those things, but yeah, the food noise chatter being reduced is so crazy. I think, the first couple months I was like, is this how thin people live? Like, is this how they think?
Yes, it is. That's the answer. Crazy. Yes. It's bizarre, right?
Yes.
I know. Like, that's exactly how Kat and I were. We were just like, I mean, it's just, it's crazy because when it happens, you're like, is this what was wrong all this time? It was utterly bizarre. Crazy. Like when it turned off, and mine turned off sort of was turning down kind of slow. And then all of a sudden it turned off like a switch. And so it was like utterly, I tell the story a lot on the podcast, like about, I was downstairs and it was really quiet. And I remember like, I thought it was like going to rain. Like I felt like it was about to rain. And that feeling, like when you just can tell like the bariatric pressure is kind of like changed and it didn't rain. And then I realized how quiet it was. And I was like, what's wrong with me? And I thought I had a stroke because I was like, why isn't all this noise there? And I didn't really even know what it was, And then I was like talking bad to myself and I was like, here we go, Cam, like another diet, another this, taking a diabetic medication to lose weight and all this other nonsense. Just talking horrible to myself. And then I realized I could hear myself talk. And I was like,
you're not having a stroke.
I wasn't having a stroke. And I was like, this is what's wrong. This is the thing, And like ever since then, I've been creating content because I can't shut up about it because I just need everyone to know that has ever struggled that you're not like, maybe you are a little broken, right? In terms of metabolic, but like, it's okay. And you can forgive yourself and it's okay. We can move forward and we can have this different life, And now I made a podcast about it with my bestie Kat and just can't shut up. So that's what we do. We're so glad to have you here. I'm sorry. I felt all kinship with you. I had to like tell you. Yes. Go ahead, Kat. I'm so sorry.
Now you can talk about Miralax and all the other stuff too, right?
We sure can. Miralax is wonderful.
Wonderful, right? Well, just really easy and really simple. We're going to start you off with like what inspires you in working with Winona.
Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs force me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Sides podcast has partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com/plus-sides. That's glpwinner.com/plus-sides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through the same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP1s is possible through Ro.
I think the biggest thing is just being able to help women. And I think being able to be on the receiving end to be able to listen. You wouldn't believe how many women write in and just are so thankful because we're the first people that have ever listened to their concerns and not dismissed it. Yeah. I think that for a lot of patients, unfortunately, when they're starting to go through issues around perimenopause, some of the early symptoms are so nebulous and have a lot of overlap with other things.
Yeah.
And I really feel like a lot of women are dismissed and told, well, maybe you need to be on an antidepressant or maybe you need this. And I think that as women, we've heard that way too many times. That's all in our head. Yes. Especially when they don't find something organically wrong that they could give you a pill for, right away. And some of those early symptoms of perimenopause, like your mood fluctuations and your decreased tolerance for people, especially the people you really love, suddenly become your nemesis. The insomnia, there's so many early symptoms that could be related to other things that I think even for women themselves, it's hard to recognize what's actually happening. Yeah. And so, that's the inspiration for me is just really being able to give women a forum to be able to, get their concerns heard. But also I really like being able to work with Winona, using it as a platform and doing podcast interviews like this, just to get education out there.
Please. Yes.
Just to share the knowledge. So women that are listening to your show right now are going to talk to their friends about it. And then they're going to talk to their friends about it. And I'll tell you, my 8-year-old daughter knows what menopause is.
That's good.
Because she hears me talking about it all the time. But the more we get knowledge out there, knowledge is power, right? And we're only helping each other as women, the more women get help and get the information they need about their own bodies, for sure.
And you do webinars, right? So Winona, you do Q&As. I've seen many of your ads on my social.
Yes. So that's been a big platform for the company. Even if women don't become our patients, we want to be able to be a voice for knowledge and information. And there's several other doctors out there in the menopause space and social media, but sometimes not all voices, agree with everyone, and sometimes it's just having things said in a different way. Yeah. But Dr. Green, our chief medical officer, and I, it's funny, everyone says, do you need to be the color of, a color to have work for the company? Because it's Dr. Green and Dr. Brown. But no, he and I both really firmly believe that doing those educational webinars, and those are free for patients to sign up for, it's just such a key piece of what we want to be and what we want to represent as a company, just to get information out there to women.
Love it. I love it.
I'd love to have you here. And we do love Winona.
I would love for our audience to understand, down really the basics, what is perimenopause and what is menopause? And let's talk about what those transitions look like. And then if we could even break down maybe symptoms and things to
Like that would be the thing that you would want to talk about, because maybe these are all coupled together, that kind of stuff. Because I feel like I've had symptoms for years, but they're more like disparate. Like, and then I think all of a sudden they all kind of squish together at one time, and I'm like,
yeah. You know what? And also, like, if they're like really like super early symptoms that we might have ignored.
Yeah, for sure. Yeah. So I'll throw a lot at you. So what's perimenopause? What's menopause?
Yeah. So ultimately, perimenopause is that time period from when you're starting this process until your actual last period. But we have to rewind and kind of talk a little bit about anatomy and physiology to understand why this happens, right? So as women, we are born with all the eggs we're ever going to have in our ovaries from the time we are fetuses. Like when we are babies, we have all the eggs we're ever going to have. Whereas comparatively, men are constantly making sperm and regenerating sperm all the time. But what happens is over our lifespan, some of those eggs kind of die off. Then when we go through, puberty and go through menarche and you have our first period, then each month we start to ovulate, and it alternates each month. However, if you have PCOS patients, they might not be ovulating regularly. But generally, we lose those eggs over time. And that's like our fertile years, right? Like the prime of our fertility and reproductive life. Well, what happens is when those egg levels get down to a certain level and we are really running out of eggs, our brain is trying to tell our ovaries, okay, recruit. We got to ovulate again. And suddenly that pathway is no longer as functional and our estrogen levels start to decrease because we just simply don't have enough eggs left to recruit. And so our cycles can start to get irregular. The perimenopause time period is when those symptoms start. When that number of eggs has gotten dramatically so low that our hormone levels are starting to get affected as a result. And the average age for menopause in America is about 52. And sometimes perimenopause can start up to 10 years before that. But that's the average age. That means that some women are going through it a lot earlier. So you can start perimenopause as early as 35, 36, which for some of us, we might still be trying to conceive at that point. And we're still thinking about that. And menopause itself is actually when you've completed that journey, right? So we can't say it's been menopause until you've gone a full 12 months without a period. So when we are having periods regularly as women, that tells us that axis of, the ovary and the brain and all the hormone fluctuations is happening normally. And when we stop having regular periods, that's when things are starting to change. But when they stop completely, that means you are officially menopausal. And then for the rest of your life, you're postmenopausal.
Oh, that's when it's called postmenopausal.
Yes.
Oh, okay. Wait. So perimenopause could start at 35 or so.
Start at 35. Most women, it's the early 40s, but as early as 35 for some women, sometimes even earlier. And it all depends on, genetics for you. Like if your mom actually started transitioning earlier, then you may as well. And now, there's some information out there too that, if you've gone through fertility treatments or you've had damage to an ovary, say from surgery, you might actually go through menopause sooner. You might start the perimenopause transition sooner.
I think it's really interesting. I know we've lost Kat, but she'll come back. I think it's really interesting that like you have to go a whole year with nothing. And then that's when that's when it's officially menopause, or that's officially postmenopause.
That's when menopause, like we can say menopause has occurred. And and the thing is that this is
time, like
this is a continuum. I think that's the hard part is like a lot of women want to be able to like get a blood test and be told like when it's going to happen. And that's just not possible. I've had patients that go 11 months without a period and then suddenly have a period. And guess what? Your clock starts all over again for that 12 months. Yeah.
The reason I want to be in menopause is not just because of the period. I don't want to be, but let me say, my friends that are in menopause, and I'm just going to say it, have said to me, and I quote, I just don't give a fuck anymore. Like, I don't know what anybody thinks about me. Like, that's what she says. And my dad's going to give this. But they're like, I literally do not care what anybody thinks about me at all anymore. And I am a chronic people pleaser. So for me, like, I would just really like to, I think doctors are a lot like that. I would love if like, let me put Kat back in. if like I didn't care. You know what I mean? Like, so part of me is like, man, I'd love to get there where I just don't care what people think about me at all anymore. Cause I'm on the internet, right? So everybody's always got an opinion. You know what I mean?
They do. Yeah.
It's different when they just talk behind your back, like good Southerners, but when they all talk about you on the internet in front of your face, it's a lot. And I wish I didn't care. So I'm looking forward to age whatever when I don't care anymore. I'm curious though, is there something to that? Is that just age or does that have to do with hormones?
I honestly think it has somewhat to do with hormones, but I think that our journey as women going through perimenopause is so chaotic and like we really go through some stuff, right? That once you get through on the other side, you're just like, this is nothing. Like, I don't really care. Like I've been through hell and back, I've been through this transition in my own body. And there's so much time during this part of our lives that we feel like we're not ourselves in our own skin. There's so many symptoms happening, so many, fluctuations in how we think and how we live. And like, sometimes we just don't feel comfortable in our own bodies. And I think that once you get through that and you're on the other side, you're like, yeah, I'm not putting up with anything I don't like anymore.
That's when the whole fuck it.
Yeah.
It's a thing, Kat. I'm telling you.
It is. No. Yeah. I get it.
Yeah. I want to know, to like, in terms of understanding this, and we were talking a little bit before the show, but, I feel, and I used a really good expression. You said, I felt very unprepared for this, like unprepared for it. And Kat and I were saying, we really haven't talked about it either. I kind of thought I'd hit menopause like 50, I'll be 46 this year. I figured I'd hit it about then. And then that's when things would suck. I had no idea that there was all this stuff before. And I would love to like, hear your perspective on that and like how and why you feel the conversation is changing around.
Yeah. Well, I think historically, it has to do with gender disparities in our society, right?
Yeah.
We are not worth much to anybody once we start aging and we're not able to reproduce and make babies.
Yeah.
Right. And it's the same thing. Like, you look in the media, it's like, older actors, male actors are still vital, still getting roles. And what happens is a lot of women are fighting. Same thing in other parts in professional lives. I think that the same thing happens in medicine. Well, what we do know is that no one wanted to do research on women, on female patients. Even the birth control pills that we've taken for much of our lives weren't researched on women because hormones and fluctuation and so many changes that the researchers and scientists said, well, there's just too many variables. Well, guess what? We were taking medications for years that had never been tested on our own gender.
Yeah.
Which is insane. Right. And so that dialogue is changing, and women are starting to be included in clinical trials more. But that's something that's huge, and I think that also, just the lack of importance on our health overall. And as we age, it wasn't until certain people came forward wanting breast cancer research to be brought to the forefront that we started hearing about that. Yeah. And really it's just that, now women are being silent and women are demanding better. And I think that as a generation and like we're all around the same age, we're just not willing to go gently into old age.
No,
we don't want to do it. I mean, I thought it was funny, like when you see, looking back at the Golden Girls, right? When I watched that show, I thought those women were in their 50s, 60s. They actually on that show were meant to be in their mid to late 40s. Was the
what?
Did you know that?
Rue McCallaghan, I think she was 50 during like when it first started.
Right.
They were, and I think one was she 48?
Yeah,
I don't know.
But like to think about like their lifestyle and how they portrayed them in the show, like they were just old and washed up ladies, right?
Yeah.
And their adventures or whatever. But like, now that we're that age, I'm like, no, there's no way. Like that's going to be me at 70 or 80, maybe. No.
I mean, don't get me wrong. I do like the idea of living with my girlfriends and getting rid of dudes and like living in Florida. That sounds great. I would do that now. No, I'm kidding. My husband, he edits this podcast. I was just kidding. Sometimes I forget. Yeah. That is so fascinating. And I did not know that. I think that's, and I know there's been, you mentioned too, that Oprah had an episode about it recently. Oprah also talked about GLP1s last year. a couple times, and then has a podcast where she's kind of been talking about it too. And she's saying the same kind of thing. Like, is this what normal people feel like? They don't think about food all the time, like when we had Rosie on the show, like, and I make this a short all the time every time I chance, because she said, I literally was about to go on the Tonight Show, my first appearance, like on national television, like as a comedian. And all I could think about was the brownies that were on the table. That's all I could think about. And, that's exactly what it's like to live like that. You know what I mean? So I think it's so good that we're talking about it. I love that there are podcasts and that there's social media that we can do all these things, and there's bad with good. Don't get me wrong, but it's just great. I think that women are taking the opportunity to have a voice, whether that's have a voice on the internet or like have a voice with their doctor. And I will tell you, like since we're all having a discussion and we all girls, when I recently went to my OBGYN, and I'd only had seen him once and I liked him a lot. And then I went back the next time and I had lost, 100 pounds. And so I had thought that it was going to be like this really positive experience, but it was horrible actually. And I know, and it was, and I made a TikTok about it because I was really upset. And the reason I was upset,
he was being a booger.
I knew better. I knew the way he was treating me was not okay. Because I do what I do with the podcast with Kat, right? And I knew better, and I didn't advocate for myself. In that moment, I was on the table and I had my drape on myself and I felt very vulnerable, and I didn't feel like I could be like, you know what, you're wrong about that. And maybe we shouldn't talk about my obesity and PCOS and type 2 diabetes because you don't know any of this. Like, you know what I mean? But I didn't, and he doesn't know anything. Like the things he was saying was like, what's your goal weight? When are you going to get off of it? And I was like, my goal is health, because I know I've had obesity a really long time. I'm not going to be skinny. Right. And he was like, well, my wife's like 130 and like, you should be under 2. Everybody should be under 2. You should never have a 2 in front of your weight. And that's what you need to do. So that's your goal weight. It needs to be under 2. And then he started to tell me like that women are smaller framed, and so they should never be heavy, and all of these different things, like just like this perpetuating disgusting behavior and thoughts and all these things that I know because I interview experts are not true. Right. And about genetics and all of these different things. And I was just so mad at myself because I felt so vulnerable in that moment, and I forgot everything. Because if like Kim that had felt confident would have said, you know what, I can appreciate your opinion on that, but I actually know a lot about this because I interview experts about this, and that's not true. Would you like to know? Or had a conversation about it and felt bold enough to do that because he is my doctor, and I should be able to talk about that and what my needs are and what my goals are, but I can't. And I think that I just totally forgot all of it.
Well, I think the other thing fundamentally with that story too, one of the worst things that doctors do is to try to have deep, meaningful conversations with you when you're naked under a piece of paper. Like, it just shouldn't happen.
Like, it is a piece of paper.
They should come in and talk to you while you're dressed.
Yes.
Then they should leave, let you get undressed. Come into the exam and then let you get dressed again before you have the deep, meaningful conversation.
Absolutely.
Like, because all of us are going to be vulnerable when we're naked under a piece of paper. Like, they don't even have real gowns anymore. Most of them.
I know, right? Yeah, absolutely.
Like a literal sheet of paper. I told Kim she should start going to mine. My OB, she's super kind. She said, you've lost how much weight and you're in perimenopause and you're on an antidepressant. She's like, I'm surprised you haven't, you've kept this much off this long. I said, well, thank you. She's like, we don't need to talk about your weight.
That's what I'm talking about. Yeah. I think that's great. Like, but I mean, like, I thought for sure it would be like, look how well you've done. Like, I don't know what I was expecting, but I wasn't expecting that. And the doctor that delivered my son, he was great. He did exactly what you just described. Mm-hmm. And I remember and he was the perfect doctor for me at the time, but I can't get to him now where he is like location wise, cause I moved, but that's exactly what he did. He met with me. And he would talk to me for a few minutes, and then he would go, okay. And then he would say, get undressed. And then I would get undressed. And then he would go, put your clothes on, meet me in the office, and we'll talk. And that was how it worked. And and I'm obese. So when I was pregnant with my son, I was like, I was looking for him to say something because the other doctors, the other time I'd been pregnant and had miscarried, had said things about my weight. And I was like, I'm overweight because I was like preparing for that. And he goes, I've seen bigger. And that was his response to me. So he kept me very safe mentally through that entire pregnancy, like, because it was very hard for me the third time
That's
around.
great.
Yeah, I know. He was great. And he was a man, So I was like, it was like, so I think when I found this other guy, I thought, well, he's younger and he's closer. So maybe that will be good. It's not, that does not equal better doctor. You know what I mean? Like, so, or a good doctor, it just doesn't. So I think like trying to find the best doctor, but I don't know about you, but like, especially if you talk about your weight, Kat and I are a little gun shy with doctors. Like a lot of us, especially with obesity, we tend to avoid it, especially because we feel so ashamed and they tend to kind of blame us. And I do think there's a certain amount of like forgiveness just from like a GLP-1 perspective that a lot of us have done on this for the doctors, because a lot of them just didn't know. Most of them still don't know, like about how it works and why it works and things.
Well, I'll tell you, I mean, unless doctors really seek out extra education, the amount of education we get on nutrition and weight management and all of that maybe amounts to a couple hours. That's about it. So unless somebody is going to get extra training in obesity management, obesity medicine, or really like learning on their own, these other things, they're really ill-equipped. I mean, medical education has a lot of flaws. I mean, we give people a good foundation, but you have to continue learning and adding to that knowledge base. But I think the most important thing, and like for your listeners, I think the most important thing when you have a doctor or a provider of any kind, like whether it's a nurse practitioner or it's a midwife or whoever you're seeing for GYN care, like you have to feel seen and heard. That's one of the most important things. And the way that our medical system is set up in this country, that things are so rushed and you're kind of whisked in and whisked out and you really don't get a chance to get all your questions answered. That's why so many people are turning to alternative forms of treatment like telemedicine. It's a nice add-on. Like I can't do your breast exam and your pelvic exam and tell you everything's normal through the computer. No, but I can provide a lot more counseling and one-on-one discussion, through our messaging than you can get with your doctor. And that's
very true because of the time, right?
Yeah.
Gas insurance, like
those time constraints.
Absolutely.
Yeah. And it's a great experience because I've used many telehealths for many different reasons. And honestly, this has been a really good one. Like I do love the back and forth and the clarity, and it's been very, very good. And
that's great to hear. Yeah. And I think that, some women come on our platform and expect like to have to schedule a video visit.
Yeah.
And they get a little taken aback when they don't need that. But then when they notice that, I can message my doctor anytime I want, I get a response back. And the flexibility of that, so when you're waking up in the middle of the night with night sweats, you can message your doctor, hey, this dose isn't right. I'm waking up like every night, you could do it at 2 a.m., and the next time we're on the portal, we message you back, it's much more flexible.
Yeah, it's really, really good. Yeah. I again, like I had no idea how this was going to go, really, but we've both been so pleased. Tell us more. I know I took about, see, now that I know you're a GLP-1 girl, you're like, I got to tell you all, I can talk to you about all this stuff.
Well, we have a GLP-1 question. We're going to tee up here for you. Like we're playing.
Yeah. Well, we can rewind and kind of talk about symptoms too. Like we didn't get into all the perimenopause symptoms, right?
Oh yeah. Okay.
Yeah. So I think one of the things that it's kind of impossible to have a comprehensive list of every single symptom imaginable. But early on, most women start to notice menstrual changes first. Usually all of a sudden your period might get a little bit more out of whack. Like you might notice you skip a month or you have spotting in between, or you might have 2 periods in a month. Then we start to notice a lot more cognitive changes too. So brain fog. If you're like me, like you're doing a million things, trying to multitask as a professional and as a mom and trying to do all these things. Yep. And you go into another room to grab something and then you see something else. And then you're like, what did I come in this room for?
Yeah.
What was it? If I don't write it down, I don't remember it now. Like I have to write everything down. I have to make myself lists of things to do.
Yeah.
So that brain fog. And the hard part about that is for us having these symptoms starting in our 40s, usually most of us are at the kind of pinnacle of our career. And we're in management or senior leadership somewhere in a company or, wherever we work. And then suddenly our brain's not working as well as it can be. And it's awful. It feels awful. Along with that, some of the other early changes we see are mood changes. So women that are prone to depression, anxiety usually get worsening of that around this time. But even if you've never suffered from depression or anxiety, you might find yourself just having more mood swings than usual and not really understanding why, and sometimes not really recognizing a trigger that could have caused it either. And then the sexual side effects, suddenly libido is out the window. Even if you are in the mood, sometimes your body doesn't want to cooperate. Like sometimes you might want to be romantic, but then suddenly you're not getting lubricated anymore.
Yeah.
Like what's happening? Vagina. Like, wake up.
We got business.
Yes, friend, what are we doing?
Yes. But there's some other subtle symptoms like, itchy skin, itchy ears. Sometimes women can notice ringing in the ears, itchy, dry scalp. Something else, we can also notice hair changes. Like, so you can start to lose hair more is a really, really common symptom of perimenopause. We all lose a little bit, our hair follicles are on a life cycle. And so we should lose a little bit in our brush here and there. Yeah. And if you have longer hair, you tend to lose more than the short haired girls. But it's one of the things that all of a sudden you might notice like, oh God, is my hair thinning? Like, am I going to go bald? Like, what is happening? Because the quality and the thickness of our hair changes. Yeah. Yes. And the downside with that is that can also happen with the GLP1s, right?
I know, right?
Yeah. So you don't know what is what, right?
Mm-hmm. Yeah. All together. It's a lot. Yeah.
Although
I think a lot of hairless, anxious people.
Yeah, I have not seen, like, my hair is not thinned out, but I can say, like, I have naturally curly hair. I straighten it. And it's not as curly as it used to be, which I'm kind of okay with that because it's easier to straighten. It's very curly.
I definitely think that hormones affect your hair. Like when I was pregnant, my hair was like completely different. Yeah. It held color different. It was like, I also had so much of it, like so much hair. And I mean, I have a lot of hair anyway, but it was just like totally different. And it was like, hormones are bananas, which is why your hair is
yeah. I hear some people have like, what is it? Like a shoulder pain or something? There's a
pain. What's that?
Well, so some women will get like what we call a frozen shoulder.
That's what you told me about. Yeah.
Yes. But also like joint pains all over can be an early sign of perimenopause too. And a lot of us are thinking like, God, are we just aging so fast that this is arthritis? Yeah. And it could be, arthritis can start to happen too, especially if you've had activities in your life or a job where you do the same repetitive motions all the time. But joint pains, and that's something I suffered from. And then until I didn't realize how much I was dealing with until I actually started HRT. Yeah. And then I realized, oh my gosh, like my joints needed estrogen back because now it's like night and day. Yeah. You don't realize how much you're suffering because we take these little symptoms and we deal with them.
Yeah.
Until all of a sudden they're not there. And it's like, wow, like this is amazing.
I feel like that's so common for women. Like we tend to deal with pain and discomfort and all of these different things as long as
take a pill and move on, right? Take a ibuprofen and just
if that, like, I just feel like that's I've seen that in so many people. And I will tell you, like, now that I mean, of course, perimenopause sucks, right? But with the PCOS, like I can't even, when I started to regulate, when I was on the medicine and my cycles were regulating, and I realized that I was having cysts every month. Mm-hmm. And I was, and when I was preparing to ovulate, I would just ache. Like it hurt all the time. And then when I would have a cyst, of course, awful, right? And then if it pops, it's worse and all the things, right? And you have to wait because there's nothing you could do. You're just popping Tylenol and Advil. And so when it went away, I was like, I cannot believe that was my baseline. Like that was what I dealt with every single month. Right. And nobody said anything. Nobody tried to help me at all. They just told me to lose weight. That's it. Mm-hmm. And again, we know because I don't think it's necessarily that every doctor I ever met was cruel, right? Or had weight bias. I think they just didn't know, a lot of them.
Well, is it true though? Like say, because I was always told until like I found a gynecologist that was like, that's absolute nonsense. But you carry more weight, there's more estrogen, which causes a lot more, maybe some lady business issues.
Yeah, it's very true. So we have 3 forms of estrogen in our body as human females, and one of those forms, our estriol, is stored in our fat cells. So that can actually be a big thing for your patients, for your listeners that are on GLP1s, is that when you suddenly lose a lot of weight and say you're on hormone therapy or you're in perimenopause, when you lose so much fat, your dosage changes and your hormone needs will change too.
Yeah.
Because suddenly you don't have that excess circulating estrogen that you once had when you were a bigger woman.
Interesting.
Yeah.
Okay. That makes sense. Yeah.
Yeah.
So so as you go, if you're on HRT or even if you're on, like, if you decide to stay on GLP-1 for maintenance, know that if your weight fluctuates, your dose may need to as well.
Yes. Yeah. And I think that that's, something women don't realize, but yes, even women that, like women that have PCOS, or that are obese are at much higher risk of having uterine cancer because of the increased levels of estrogen in their body, because they have more unopposed estrogen compared to their progesterone, which progesterone is our other major female hormone that counterbalances estrogen. And estrogen has so many positive effects throughout our body, like with our brain health and our heart health and our blood vessels and our muscles and everything. But the one place it can do damage if it's not balanced properly is that lining of the uterus. And so especially when you're taking hormone therapy and if you're in perimenopause or menopause, it's really important if you still have your uterus that you're taking progesterone with estrogen all the time. Because, basically estrogen kind of acts like it comes in and it makes that uterine lining fluff up kind of like a shag carpet. Whereas the progesterone comes in like a little vacuum cleaner, keeping it thin, like thinning it out. So if you have too much estrogen in relation to your progesterone, that lining will just keep growing and growing and growing. And then cancerous cells can develop from the overgrowth. Okay. So, yeah.
Wow. Fascinating. I do remember too in terms of, in fluctuations of estrogen, like I had my gallbladder out. It was awful. I had the stones and they got in my bile duct and it was bad. I turned like I was all yellow. It was utterly bizarre. But when I went to the doctor or when my surgeon came in, I was like, is this the GLP-1? He was like, no, it's from fluctuations of estrogen. He's like, that's why you get stones. But a lot of people think that because that's usually like, he said it was like throughout your life. Like it's not this one time, right? But like the diet culture and the rise and your estrogen up and down, right? Yeah. But a lot of people don't know that. And I think also like the pancreatitis thing. So one of the doctors was telling us like about, versus like the stones, because they're all right next to each other. Mm-hmm. They were saying like, if you don't have a gallbladder, like the issue is that you would get stones and the gallbladder would get put, and then it would like all of that would push together, which would cause the pancreatitis. And so I wonder if like nobody would have a pancreatitis issue if they're on these, you know what I mean? Like, is that what it was? I don't know. We dig into this stuff a lot. Sometimes doctors don't totally know, but we just like to speculate.
Yeah. I think we're learning more and more each day is the big thing,
Absolutely. Together, which is nice.
Yes, absolutely.
Hey, Plus Siders. We're so glad that you were able to tune in for part 1 of the episode. Part 2 will be posted next week. We look forward to seeing you then. Have a great week. And remember, you're not alone. It's not your fault. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m. and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you have this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plus-sides with a Z, making healthcare work for you. Check out the link in our show notes for more details. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.